joining us now, infectious disease physician and medical director of Special Pathogens Unit at the Boston University School of Medicine, Dr. Nahid Bhadelia. She's an NBC News and MSNBC medical contributor. Dr. Bhadelia, great to see you again this morning. This must be incredibly frustrating for you to watch because you've been with us for 4 months now saying testing is the key, testing is the key, testing is the key. We've got to identify who has coronavirus. We can isolate them, get our arms around this. Why now, as we sit on July the 9th, cannot the city of Phoenix get enough tests?
Well, Lee, thanks for having me. I mean, you're right. And I think partly what's frustrating is that we saw the country go through this already in the Northeast, and we know where the issues would arise. The issue has not just been the availability of tests, because people are waiting a long period of time to get tested. But then when they're getting tested, you're hearing from everywhere from Georgia to Arizona to other states that are being affected that they're waiting for a really long time for those results. And the impact that has is, if you don't know that you're sick and you're not quarantining, or they're not able to contact trace you because you tested and come back positive, then you're in the community spreading that disease. And so what you heard the mayor speak about, the idea that they're seeing exponential rise, that continues. That becomes a cornerstone. And I heard your conversation just now with Matt Lemire, the conversation about opening schools. The evidence shows that children are, yes, 1/3 or half as likely to get this infection. Many children do not get as sick as adults, but some do. They end up in the hospital. We have this mysterious multi-system inflammatory syndrome that shows up in some children. We don't understand quite yet what the pathology of that is. And then when you look at around the world, when you look at sort of the risk of this transmission, a huge part of that is tied to prevalence. The countries that have done some small opening or altered opening of schools, it's very much tied into the prevalence of disease in those communities. So if we want to open schools, a major thing that we have to do is to drive those cases down.
And that's the thing the president is talking about, a national reopening of the schools, even as each state, each school district even has different numbers of cases, and the crisis is more acute in some places, of course, than others. So as you listen to the CDC saying it will now change its guidelines after the president protested them and relax them, make them less restrictive, as the president called them, what do you make of that, where the CDC is actually stepping back a little bit and saying, well, maybe we will make it easier to reopen schools?
Well, just stepping back a little bit, right? I mean, talking about the elements that go into a successful school opening, it will require all of us to do our part, as I said, with community transmission. But then we need the physical engineering, like having the ability to physically distance kids. Do we deploy masks in what areas? Social engineering. Do we put, teachers and students into pods? How do we get those logistic supplies, and how do we link, things like disinfection, gloves, ability to sort of wear those masks for kids who can't afford to get them from home, and then to link everything to a public health infrastructure that is ready to follow up outbreaks if they happen in those settings. So we all want to open schools. Opening schools is the correct thing to do socially if we can, for our children, for their physical development, for their mental development, social development. But with doing it without the correct, preparation, if you open schools and you're doing it without those preparations, you're actually looking at a public health disaster timed exactly for October and November. I mean, I think it's short-sighted for the president to say what he said. So when I see that tweet from the president to the CDC, it's a bit more damaging than what it appears at first blush. I think that the school reopening versus public health is like the new false dichotomy. You're being asked to choose one or the other rather than realizing that you need the resources for A, to have B open.
Yeah, and you've got to have a plan to reopen the schools safely, not just say reopen or I'm going to cut off funding. Another alarming bit of news that we're seeing from multiple outlets, Dr. Bhadelia, is reports that hospitals, nursing homes, private practices are among those on the front lines, again, facing a dire shortage of respirator masks, isolation gowns, and disposable gloves, PPE. Doctors at Memorial City Medical Center in Houston reportedly have been told to reuse single-use N95 masks for up to 15 days. The New York Times notes some hospitals in Florida are handing out only loose-fitting surgical masks to workers treating presumed asymptomatic patients. Vice President Mike Pence yesterday seemed to dismiss those reports, instead encouraging the reusing of those supplies.
I have received encouraging reports even through this morning strong supplies of PPE in hospitals. Hospital capacity remains strong. We also are issuing renewed guidance on preservation and reuse of PPE. We're encouraging healthcare workers to begin now to use some of the best practices that we learned in other parts of the country to preserve and to reuse the PPE supplies.
Dr. Padilla, a question again, just like the one I asked you on testing. How are we back here again? PPE, as we know, in those early days in New York City, especially in New Jersey, was short. You had emergency room and ICU physicians and nurses reusing that personal protective equipment. But here we are again. How did we get here?
Well, and here in Boston and all of Northeast, we suffered the same crunch. And you know, the only thing we had going for us when we were looking at this and coming up with strategies across the Northeast of using the same N95 sometimes for an entire week, at least for an entire shift, and trying to do these innovative technologies that allowed us to do disinfection of those masks to try to reuse them, at least we had the hope that there might be some, you know, manufacturing benefits by the time that we're here. The big issue is still N95s. The respirators remain a shortage across the country, and the manufacturing capability to help provide for the increased need for this in anticipation of the fall is still not ready. We're still looking at supply chains that are not able to apply that. And I think one big reason that we're here is that we did not make the investments in that manufacturing capacity to the level that we needed. You know, we did fine. We have ventilators, but a response takes continuous investment and then furnishing of any new shortages that come along. And N95s are shortages that we've known. The respirators and personal protective equipment are shortages that we've known. The reason we're here is that we do not have a national strategy. You know, I feel like I'm becoming a broken record, but we don't have the capacity to think of this as a collective. And at this point, I think states probably need to just come together to make that collective, to come up with that plan, because we're not getting that from the federal government.
It remains a state-by-state scramble, as you say. Dr. Naheed Bhadelia, great to have you with us as always. Thanks so much.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.